Welcome, and thank you all for joining us. Tonight, we will be talking about monkeypox, an emerging public health concern in our city. I'm Dr. David Rose, the director of the Alexandria Health Department and a board-certified pediatrician. We have subject matter experts from across the health department presenting today. They are epidemiologist Skylar Mackey, public health nursing supervisor Debbie Diamond, and our department's medical director, Dr. Kim Luke. I want to thank them for their hard work and for their time tonight. We all are excited to give our community the answers and resources needed about monkeypox. So let's get started. Our goal in providing this information session is twofold: to address confusion about this disease, while also telling people what they can do on an individual basis to protect themselves. We will start off with an overview of monkeypox as a disease, where it came from, and what it looks like. We will address some of the things that can put a person at risk for monkeypox exposure, and some steps to take that will lower that risk, including vaccination. And finally, we will be sharing a wealth of resources for anyone who has questions or concerns about monkeypox. First up, Health Department epidemiologist Skylar Mackey to give the general overview of this disease.
Good evening. Thank you, Dr. Rose, for the introductions and overview. As Dr. Rose mentioned, my name is Skylar Mackey, and I am an epidemiologist with the Alexandria City Health Department here in Northern Virginia. Today, I will be speaking on 3 topics, including providing an overview of monkeypox. I then will discuss how the virus is spread. And lastly, I will be talking about who is currently at risk. Monkeypox is an orthopox virus, similar to smallpox, but milder. The virus causes a rash, which means it shows up as lesions, blisters, or bumps on your skin, and those are the most contagious part. Monkeypox is a rare disease, but it has been around since the 50s. It's not a newly evolved virus like COVID-19. The first known human case of monkeypox was found in 1970. Although the current outbreak is unusual because there are a large number of infections being seen outside of areas where it is a common disease. As I mentioned, monkeypox shows up as a skin rash and can spread when that rash comes into contact with clothes, towels, bedding, and other people's skin. It is not a sexually transmitted infection. It can spread through any kind of prolonged skin-to-skin contact or contact with those fabrics or objects. Monkeypox can spread to anyone through close, personal, skin-to-skin contact, especially direct contact with the rash, sores, or scabs on a person with monkeypox. This is the most common way that it is spreading in the US right now. Although rare, you can also get it by contact with objects, fabrics like clothing, bedding, towels, utensils and surfaces that have been used by someone who has monkeypox. The virus can spread through the rash and sores until all the scabs that form on the sores have fallen off and a fresh layer of skin has formed underneath. Another possible but less common way it can spread is respiratory secretions. So those are droplets from the mouth or nose during talking, sneezing, coughing, heavy breathing, or any other face-to-face contact. As I said previously, it is not known to be a sexually transmitted infection, but it can spread through any kind of skin-to-skin contact, and that includes sex. It also includes hugging, dancing, or even kissing. Monkeypox does not spread from person to person from walking past someone who is infected or through casual conversation. So you're not going to catch monkeypox through casual contact with a contaminated surface or infected person, meaning you're not going to get it while trying on a jacket at the thrift store or walking by someone briefly with a monkeypox rash on a bus or at a festival. It is not as contagious as something like COVID-19. Remember, it mainly spreads through direct contact like touching a rash. Now that we've talked about how it spreads, let's discuss the signs and symptoms. People with monkeypox can first develop symptoms that include a flu-like illness with fever, headache, muscle aches, exhaustion, and swollen lymph nodes, followed by a rash. And that rash can look like pimples or blisters. The time from being exposed to when a person could develop symptoms is typically 7 to 14 days from that date of exposure, but it can take up to 21 days. Monkeypox is contagious as long as the bumps are present. And this rash or those bumps is the important symptom to recognize, since that is the main way it is being spread currently. In order to be considered no longer contagious, the bumps must be completely healed with a new layer of skin. This usually takes 2 to 4 weeks, and it usually heals without needing treatment. We have included photos of recent monkeypox infections on the next slide to show examples of what that could look like. It's important to note that in recent cases, some patients have developed bumps on or near the genitals or anus without having flu-like symptoms first. So being diligent about examining your own body for new bumps or rashes is very important. As you see here, the rash can look like pimples or blisters on any part of your body, even if it's only 1 or 2 bumps. The bumps or rash may be painful or itchy and can appear anywhere. They can be inside the body, including the mouth, anus, or vagina. Other locations we have seen recently include the hands, arms, feet, face, and chest. Anyone can be impacted by monkeypox regardless of their gender identity or sexual orientation. Anyone can get monkeypox after an exposure to someone who has the infection, including partners, colleagues, parents, children or siblings, among others. Based on reports, many, though not all, of the recent cases have been among gay and bisexual men. A recent report published by the Centers for Disease Control, the CDC, found that among 2,891 cases reported in the United States through July 22nd, that 99% of cases were male and 94% of those cases reported close or intimate contact with another male. This means that men who are gay, bisexual, or same gender loving have been affected the most so far by this monkeypox outbreak. However, identifying as gay or even identifying as a man does not make you more likely to get it. Through science, we know that risk is a result of behaviors and actions, not identity. So it doesn't matter if you're straight or you're gay, your level of risk is based on your activities. What we know is that if you have close physical contact with more than one person, you will have a higher chance of getting monkeypox. We here at the Alexandria City Health Department are carefully monitoring monkeypox that may be spreading in any population. I want to end my portion of this information session by saying that we really urge everyone to approach this outbreak without stigma and without discrimination. Protecting our community starts with building awareness and making informed decisions guided by science and quite certainly not stigma. Thank you. And now I'm passing the mic over to Debbie Diamond.
Thanks so much, Skylar. As she said, I am Debbie Diamond, a public health nurse supervisor here at Alexandria Health Department. And I would like to take a bit of time to discuss with you how to realistically assess your risk for monkeypox and develop your risk reduction plan that fits you. Right now, the spread of infection in Alexandria in the US is primarily occurring among socially connected men who have sex with men, where intimate, sustained skin-to-skin contact occurs with their partners. This same intimate skin-to-skin contact or rubbing on a rash or bumps can occur with others who are intimate as well, but there has not been many infections that made that transfer. Your risk reduction plan can include one or all of the following. you can be talking to your partner or partners. And this is one of the most important steps in prevention. Prior to sexual or other intimate encounters, ask your partners about their sex practices. Talk about yours. Discuss how many encounters you've had recently, and if you think you may have been exposed. Before the lights go out, look at each other. Check for bumps, blisters, or rashes, so that if someone does have signs of monkeypox, you can find safe ways to be intimate without rubbing and help each other get connected and connected to testing and treatment resources. The majority of people who are contracting monkeypox right now have more than one sex partner and/or anonymous sex partners. Having more than one partner or partners that you have not vetted will increase your chance of coming in contact with monkeypox. Consider reducing the number of people you have sex with and possibly exchange contact information with each other so that in case someone gets infected, they can be informed. We have had several cases in Alexandria that reported attending group sex spaces as their possible source of infection. If you want to reduce your risk, consider avoiding those venues, spaces like back rooms, saunas, public or private sex parties while this epidemic continues. Condoms are not 100% protective against monkeypox. However, they can help reduce your risk. Remember, the transmission is usually through sustained skin-to-skin contact, particularly with the blisters or rash associated with monkeypox. And unfortunately, you might not be able to see those sores if they are inside a rectum or a throat. So condoms may reduce your risk of monkeypox transmission and will protect you from other sexually transmitted infections. There will be more discussion about vaccination later, but for now, it's important to know that monkeypox vaccination can reduce your risk of infection if you are exposed, and you will need to consider this when you decide the steps you will take to reduce your risk of infection. Monkeypox transmission continues to be studied, and we are learning more from the current outbreak than when we started. We are learning if monkeypox virus maintains viability and can be spread through feces and semen. Early studies show that men who recovered from monkeypox should wear a condom for 8 weeks after their symptoms are gone, as a possible way of avoiding infecting others with semen exposure. The efficiency of transmission from contact through touching or sharing fabrics or other surfaces is still being studied, so one can consider not sharing items including clothing, sheets, towels, sex toys, or other items that might carry the virus whenever possible. The same efficiency of transmission through sustained sharing of saliva is not well documented, but the virus has been found in this body fluid, so reducing risk could include thoughtfulness with intimate hugging and kissing, where you might be exposed to the saliva or droplets of infection, or even unseen sores in another person's mouth. As with COVID-19, we are learning more and more each day about monkeypox. There are some things we don't know and others we do. I ask you to stay informed. Monitor reliable websites for new science-based information. Make your own risk reduction plan and adjust as we learn how to do something more. Please call our hotline at 703-746-4988. If you have any questions or concerns, we want to work with you to confront this outbreak and reduce the risk of transmission to others. We've just discussed risk reduction that includes knowing about monkeypox, how it spreads and where it's occurring, looking at ourselves to determine if we are at risk, and making a risk reduction plan that fits each of us, and that may or may not include a vaccine and some changes in activities. These strategies aren't new to us and are the same type of things we've been doing for more than 2 years if we protected ourselves and others in our community from COVID-19. Monkeypox is not nearly as contagious as COVID-19, but much of what we learned about COVID can relate to monkeypox and any other communicable infections, such as washing hands, using cleaning procedures for services, and yes, even sometimes wearing a mask. So if you know somebody with monkeypox, there are specific steps you do need to protect yourself from getting it. Avoid the skin-to-skin contact with rashes, sores, scabs from a person who has monkeypox until the rash is fully healed. Do not touch, but wear gloves when handling contaminated materials, such as bedding, clothes, and towels, or the dressing used to cover the rash. Turn gloves inside out when you take them off and throw them away in a closed trash bag. And wash any of those items that touched the person with a rash with detergent and hot water. Do not share eating utensils or sex toys. Wash your hands often and wear a mask when you have lengthy contact around somebody with monkeypox. Next, I'd like to welcome Dr. Luke, our medical director of the health department, to talk about what to do if you are sick. Thank you.
Thanks, Debbie. Hi, everyone. So we've just gone over how monkeypox presents, how it spreads, and which activities most likely increase the risk of being exposed to the virus. And I'd like to take a moment now to go over what to do if you develop symptoms. Generally, the risk of becoming ill with monkeypox is low if you did not encounter the high-risk scenarios discussed earlier. But particularly if you did have high-risk exposures, be on the lookout for any new or unusual rashes that develop, or for flu-like symptoms such as fever, chills, body aches, swollen lymph nodes, and exhaustion. When you recognize these symptoms, you can prevent passing on the infection by covering your rash and lesions, wearing a mask, washing your hands often, as Debbie just mentioned, and physical distancing, isolating from others, including avoiding gatherings, avoiding sex, or intimate skin contact with anyone until you've been seen by a healthcare provider to make sure things that are okay. Cases of monkeypox have ranged from mild symptoms with few lesions to more severe with intensely itchy or painful lesions, some in very sensitive areas, and rarely involving other body systems causing difficulty breathing, chest pain, or confusion, all those things for which you'll need to seek immediate care. If you start experiencing monkeypox symptoms, even if they are mild, talk to your healthcare provider immediately. Your provider can help you get tested, recommend ways to treat your symptoms, and even look into getting TPOXX, which is the drug approved to treat smallpox, but is thought to help with severe cases of monkeypox or to prevent severe cases for people who are at high risk for severe disease. And it's currently under a CDC review protocol for use with monkeypox. They can also provide you with the documentation you may need to excuse you from work while you are in isolation. And if your healthcare provider does not yet have the resources to provide testing or treatment, you can always have them call us for guidance and we will walk them through the process. Or if you do not have a healthcare provider or if you do not have insurance, you can call us at Alexandria Health Department and we are ready to help you. If you're diagnosed with monkeypox, continue the same isolation precautions until all your sores have healed and a new layer of skin has formed, and usually that takes about 2 to 4 weeks after sores first appeared. You're also going to be receiving a call from one of our public health workers, and they'll check in to see how you're doing, work through any challenges you may have, and see whether you need any resources to help you with the difficult task of isolating. Also, if you were not able to see a healthcare provider, let them know and they'll work with you to connect you with one. They will also be asking you about your recent sexual contacts or other close contacts to help notify them about their recent exposures. This is always done anonymously, meaning they will not be telling any partners or close contacts any of your information, only that they were identified as a contact, so that they themselves can monitor for symptoms and get tested, vaccinated, or treated as needed as indicated. Next slide, please. So the same applies conversely. If you yourself were told you were exposed to someone with monkeypox, we would encourage you to monitor for symptoms a little more closely than usual with daily, twice daily temperature checks, examine your skin, and look into getting vaccinated to decrease your chances of developing severe symptoms or infection. And if you do develop symptoms, then again, isolate, contact your healthcare provider, and work with us to inform close contacts. And now, Debbie, we'll pass it back to you to talk a little bit more about vaccine options. Thank you.
Thank you, Dr. Luke. For members of the public who may be high risk of exposure, Jynneos is the current available vaccine for individuals who might identify as in any of the following groups. First, you were told by an intimate partner, someone who you were physically close to, where you could have rubbed the skin or rash for a significant length of time, and or the health department that called you and informed you that you were exposed. All people of any sexual orientation who have had at least 2 weeks, in the last 2 weeks, had anonymous sexual contacts. This could be at a club or on people you meet on an app or other folks where you never really use your names. All people of any sexual orientation or gender who have had more than one sexual partner in the last 2 weeks. Sexual workers of any sexual orientation or gender. Staff or attendees of any sexual orientation or gender at an establishment where sexual activity occurs, such as a bathhouse, sex club, or sex party. Now, you might ask why you've heard the 2-week time frame in the eligibility criteria. The answer to that is we try to prevent infections by vaccinating people within the time period after they could have been exposed, but before they would have become contagious. Next slide, please. Right now, widespread vaccination against monkeypox is not recommended or even necessary for most people. Jynneos is only recommended and available for contacts to cases and those of us at high risk for exposure and meet the eligibility of a criteria. If you have been exposed or if you determine that you meet the criteria for vaccination and want to make vaccination part of your prevention plan, you can make an appointment by calling the health department at our number we've said before, 703-746-4988. Email us at alexhealth@vdh.virginia.gov or go online and complete the vaccine registration survey, the red cap link on your screen, which appears on our website shown at the bottom of this screen also. I noticed I skipped a slide and I apologize. If I may ask that we go back 2 more slides. I think it's important for everyone to understand that Jynneos is a vaccine that is being used to combat our outbreak. And it is being used for those who are at risk to reduce their risk of infection and or even also decrease symptoms if they are infected. Jynneos was developed in partnership with the U.S. government to protect people from the smallpox virus, and which is now an extinct virus except in laboratories, and a close relative of the monkeypox. Studies done as far back as the 1980s show us that it's safe and effective vaccine. This vaccine is fully approved by both European health authorities and the FDA, and it was approved in Europe in 2013 and by the U.S. Food and Drug Administration in 2019. The U.S. government had stockpiles of this vaccine ready in case of an outbreak of smallpox or monkeypox. The scale of any outbreak is impossible to guess. The extent of the current outbreak of monkeypox in the U.S. and the world was not anticipated. This is why there is not enough vaccine for everyone who wants to get one yet. The Jynneos vaccine is available in Alexandria for those who need it to reduce their personal risk of infection and decrease the spread of infection in our community. It is given in 2 doses, 4 weeks apart, like many vaccines. It's important to note that just like other vaccines, it does not serve as a perfect protection from infection. It can reduce chances of being infected and symptoms reduction if one becomes infected. The best prevention plan is one that may include vaccination and some or all of the other steps discussed earlier in this presentation that can work for you. You can take valuable steps to lower your risk of exposure to monkeypox and help reduce the spread of infection in our community. If I may ask, can we move forward 2 slides where we one more time look at the ways we can sign up for vaccination is by calling our phone number 703-746-4988, email us, or visit our website in order to complete the Red Cap survey. And now I'll return it back to our health director, Dr. David Rose, to rejoin our conversation.
Thank you, Debbie. And thank you for your work and your expertise. As we bring this information session to a close, I would like to take a moment to discuss that work and what the health department is doing not only for individuals impacted by monkeypox, but the Alexandria community as a whole. Our mission is to contain the disease and reduce its impact locally. So for those most at risk or possibly exposed, we are providing vaccination, testing, and counseling, in addition to resources like this presentation that serve to inform individuals about the disease. People diagnosed with monkeypox are educated on how to prevent further spread, obtain relief from symptoms, and seek treatment. Support is provided for those who need other services, such as testing for sexually transmitted diseases or food and supplies to facilitate isolation. Additionally, the health department conducts thorough case investigation and contact tracing. We identify people who were in contact with the person with monkeypox in order to quickly vaccinate those without symptoms, as you heard, to prevent illness or decrease its severity, and to rapidly test anyone who becomes symptomatic. For residents without health insurance, we provide monkeypox screening and treatment at health department clinics. Lastly, regarding the general city population, we provide educational resources and opportunities like this virtual information session. We also develop supports for community settings, giving guidance on reporting, cleaning, and communication for those that they serve. These settings include schools, daycares, hotels, detention centers, long-term care facilities, shelters, and group homes. Thank you again, presenters, for delivering all of the practical information so that we can all be a little more prepared and knowledgeable about monkeypox. For our viewers, we hope this provided the answers and resources that you need to make informed decisions. But if you have any lingering questions, please feel free to contact the health department either via email or phone, as you see on the screen now, and we will be happy to help. For all of us at the Alexandria Health Department, we wish you the best of health. Good evening.